So I'm just going to briefly talk about the future, our work over the next few years, because it'd be great if it was all over and we could just sit back now and think, well, every year now 100 new students are going to graduate from the College of Health, and we've done it. But there's, of course, lots more to do. So we've got quite a busy year coming up. We've got a curriculum evaluation coming up in February, which basically means that we have a look at what we've done so far and the training program, and we look to see if it's the right thing, basically. Is it preparing people to do what they need to do? So we're having a meeting with key stakeholders in Ghana, quite a big meeting, and we're all going to discuss it and decide if the program needs adjusting and if we're on track for the right sort of workforce expansion. We've got 72 practitioners now out across Ghana working, and they could get quite lonely, and they could feel somewhat neglected because it's a big country, of course, the size of the UK. So there's a big job for us now in keeping in touch with these practitioners and helping them to feel supported, providing them with ways of developing continuing professional development, supervision. I mean, if you look at we try to be evidence-based, and if you look at the evidence, programs fail because people don't get supervision and they do feel neglected and they leave their jobs. And they also fail because they don't get the continuing professional development and they go stale and they get fed up. So we're focusing on those two things quite strongly. And even just we have it's great, we have a bulk SMS system where we can send out text to loads of people. We sent out 72 last night to these 72 practitioners. We had 30 replies by this morning, and they'll like us to keep in touch with them. Everyone carries a mobile phone in Ghana. So we're working with the University of Winchester. We've not mentioned them before, but we do some partnership work with them, and we're looking to develop what we call a learning, teaching and development unit at the College of Health, so that our new developing educators can get some certification as clinical educators, and also the practitioners that go out and start working can come back and do some CPD in that centre. So we've got a lot of plans, and we're hoping to sustain the developing workforce. We have an exit plan for 2018. We're trying to finish this by 2018. We hope that by then there'll be a large enough workforce in Ghana. It'll be, I suppose, the word critical mass. It will have reached that critical mass. And there'll be systems in place. There'll be an organisation for, sort of semi-professional organisation for the practitioners to meet together, an association, if you like, and all these things for them. So that's our plans.